Okay, hello and welcome to the deep dive, and specifically welcome to what we're calling the 21st Century Man podcast. This is our series where we're really digging into each chapter of this fantastic book.
That's right. And today we're cracking open chapter 38. It's called Joint Health is the Key to Staying Active.
Yeah, and this one draws insights from an orthopedist, Dr. Will Workman. It's packed with really useful stuff on, keeping everything moving as we get older.
It really is. Because let's face it, maybe in our younger days, we kind of took our bodies for granted. Recovery felt automatic.
Totally. Aches were just temporary background noise. Now, things can feel a bit different. Persistent pains, they're just more common for a lot of us.
Exactly. And this chapter isn't about just toughing it out. It's
Yeah.
about thinking smarter, understanding the signals your body sends.
So our mission today is basically to pull out the key findings from this chapter.
Yeah, highlight the most important takeaways for you, the listener.
Yeah.
We'll try to explain any jargon, any terms that sound complex.
And hopefully give you some real actionable things you can do to, well, keep your joints healthy and just stay in the game, whatever that means for you.
Okay, so where do we start? The chapter kicks off with a pretty fundamental idea.
Right, that staying active isn't just, for fun or competition. It's actually essential for the whole body to function optimally.
And the core message there is about movement. Keeping your joints moving is absolutely crucial for keeping them working well over the long haul.
There was that fascinating detail about the knee, wasn't there? About passive motion.
Yeah. That even just moving the knee joint gently without heavy load can actually stimulate cartilage growth.
Yeah.
It's like the joints need that movement.
Which kind of goes against what you might think, like maybe resting it more protects it.
Well, yes and no. Because Dr. Workman also points out the flip side as we age. High impact activities. Things like, heavy running, jumping.
Right.
Those can actually speed up the breakdown of that cartilage, especially if the joints had some trauma before.
So that brings us to a really critical point the chapter makes. Learning to actually listen to your body.
Those signals, aches, sharp pain that just hangs around after activity, or maybe clicking, locking sensations, those aren't just minor things to ignore. They're signs that a joint might be at risk and needs, some attention.
So just bracing up and pushing through isn't the smart move?
Definitely not with those kinds of signals. It's about a more thoughtful approach, figuring out why it hurts.
Okay, so movement is good, but high impacts can be bad. What's another big threat that the chapter warns about? It was pretty stark.
Oh yeah, the whole sitting is the new smoking line.
Wow, that really grabs you. Why is sitting so bad for joints, according to Dr. Workman?
It's kind of a double whammy. First, sitting a lot often goes hand in hand with gaining weight.
And extra weight means extra stress on the joints, especially knees and hips.
Exactly. Immense pressure. And second, when you're sitting still for hours, there's just no movement happening in those joints. You're not getting that cartilage stimulation we just talked about.
So the cartilage, the cushioning, it can sort of degrade faster.
Right. It accelerates the wear and tear. You end up with less cushion, more chance of bone-on-bone friction, which equals pain. And the book clearly states this happens faster in people carrying more weight.
Okay, so the solution isn't no movement, it's smarter movement.
Precisely. The big recommendation is shifting towards low-impact sports and exercises. Activities that keep the joints moving, keep them lubricated and stimulated, but without all that heavy pounding.
And the chapter gives a great list, lots of variety, things like swimming.
Yes, swimming, tai chi, yoga, cycling, even doubles tennis instead of singles, because there's less court to cover.
Smart weight training too, right? And just plain old walking or hiking.
Absolutely. All kind of options for the joints while still getting that essential movement.
Okay, let's dig into the more comprehensive strategies then. Dr. Workman talks about how joints can wear out, and it's not just one thing, is it?
No, he mentions a few pathways. There's disuse, just not moving enough. Then there's overuse, doing too much, often repetitively.
Or even bouncing between the two.
Yeah, alternating periods of inactivity with bursts of really intense activity. And then, of course, there's the genetic component you can't ignore.
And overuse, how does the book define that? It's not just about being a pro athlete, really.
No, not at all. It's defined as any narrowly constrained activity pattern. Repetitive motion, high volume. It could be an exercise routine, sure, but it could also be related to your job, like certain types of manual labor or even poor ergonomics at a desk.
Gotcha. So, boiling it down, what are the key things we should be doing?
The chapter lays out some core strategies. First, keep your weight down. That reduces the load.
Makes sense.
Second, Choose lower impact activities more often than not. Third, exercise, but do it in moderation. Don't go crazy every single time.
And variety, that was a big one too.
Yes. Mix up your activities, use different movement patterns. Don't just do the exact same thing day in, day out.
Okay, now here's something interesting. The chapter talks a lot about tendons and muscles, not just the cartilage itself.
Right. Because while figuring out how to actually restore damaged cartilage is kind of the ultimate goal, the holy grail, as he puts it.
Yeah.
Strengthening the muscles and tendons around the joint is something we can actively do, and it's incredibly effective. Stronger supporting structures actually take strain off the joint surface. They unload it.
How does activity actually strengthen tendons?
Well, the stimulus makes the individual fibers thicker, but maybe more importantly, it increases the connections, the crosslinks between those fibers. Imagine weaving more threads into a rope and tying them together better.
Makes it a stronger bundle. Is that where the analogy comes in? The springs?
Exactly. He calls tendons your body's springs or shock absorbers. Stronger tendons are better springs.
So they soak up more of the impact.
Precisely. Less force goes crashing into the joint cartilage. He uses this great comparison. An old car with shot suspension versus a race-ready sports car. You want your body suspension, your tendons and muscles to be finely tuned.
And that ties straight back to weight, doesn't it? The load on those springs.
Absolutely. The chapter mentions studies showing heavier people had way more cartilage breakdown after the same activity compared to lighter people. The springs just couldn't handle the extra load as effectively.
Okay, and beyond just tendon support, what else does strength and flexibility training do for us?
Oh, lots. It helps with weight management. Obviously, more muscle means a higher metabolism. It fights that natural age-related muscle loss, which is kind of like osteoporosis from muscles.
Sarcopenia, right?
Right, sarcopenia. And honestly, being stronger and more flexible just makes doing any activity feel better and easier.
The advice for middle-aged guys on strength training seemed key, too. It's not about becoming a bodybuilder.
No, definitely not. That kind of extreme, repetitive lifting over years can actually lead to arthritis in some joints. The goal here is functional strength being toned and strong enough to support your activities.
So moderate, gradual increases.
Yeah, start lighter, build up slowly, and crucially, allow more recovery time. The book kind of jokes about the glory years. You just don't bounce back as fast. What took a day might take several days now.
Listening to your body again. And diet comes into play here, too.
Briefly touches on calorie restriction, maybe affecting DNA damage related to muscle health, but stressing that the calories you do eat need to be high-quality, nourishing ones. You need good fuel.
So the premier strategies, as Dr. Workman calls them, really circle back to that foundation. Low-impact activity plus the right diet in the right amounts.
That's the bedrock.
Okay, but what if you're doing all that and, pain is still a problem? The chapter gets into managing that, too.
Yeah, it acknowledges that reality. It talks about anti-inflammatory supplements first.
With the caveat that supplements aren't regulated like drugs, right?
Exactly. But it does mention some that have decent scientific support behind them.
Like what?
Krill oil or omega-3s in general. For those tiny shrimp-like things, similar benefits to fish oil for inflammation, potentially helping with arthritis pain.
Okay. And Boswellia serrata, that sounded familiar?
Right.
Frankincense.
That's the one. An ancient spice, used for ages in India. It's thought to have anti-inflammatory effects. The book even mentions an Arthritis Foundation recommendation. Look for 60% boswellic acids, maybe 300, 400 milligrams 3 times a day.
Interesting. And the third one was curcumin from turmeric.
Yeah, described as the phytoactive part, basically. The key beneficial compound from the turmeric plant. Again, long history of use, especially in Asia, and now widely looked at for joint pain relief.
So supplements are one avenue. What about actual medications?
Covers the basics that most active people know, the NSAIDs, non-steroidal anti-inflammatory drugs.
Like Aleve, Motrin, Advil.
Ibuprofen.
Right, the standard
Sure.
stuff. But it also highlights topical NSAIDs.
Gels you rub on.
Exactly. Voltaren gel is the example given. It's prescription strength, but applying it to the skin lets it work right at the joint site.
Oh, so it could be good for people who get stomach issues from pills.
That's a major benefit, yeah. Less systemic exposure, more localized effect. Okay, so let's say you've tried lifestyle changes, supplements, maybe basic meds, but the joint pain or limitation is still significant. What's next?
Then we move into the medical intervention territory. Dr. Workman discusses therapeutic injections, specifically mentioning platelet-rich plasma, or PRP.
PRP, heard of that. How does it work, in simple terms?
It sounds fancy, but the idea is pretty straightforward. They take some of your own blood,
Okay.
spin it down in a centrifuge that's just a machine that spins really fast to separate blood components to concentrate the platelets and other healing factors.
And inject that concentrated stuff back into the joint.
Yep. The platelets contain these little storage sacs, alpha granules, packed with growth factors and cytokines. Those are like immune signaling proteins. When injected, they release these factors, which can help decrease inflammation and maybe support cartilage health. Studies show it could be promising for certain conditions.
Okay, what if things are more advanced, needing imaging or maybe even surgery?
He talks about more sophisticated MRI techniques, like cartilage mapping. It's a special sequence that color codes the joint surface on the scan.
To show exactly where the cartilage is damaged.
Exactly. It gives surgeons a really detailed picture of unhealthy areas, helping them plan procedures if needed, like maybe grafting.
Grafting, like patching the holes.
Sort of. Using healthy cartilage, either from another part of your joint or from a donor, to fill in those specific defects. These techniques have been refined over decades. He also stresses repairing the meniscus in the knee whenever possible, that C-shaped cartilage is vital for cushioning and stability. Saving it is a big deal.
Which leads us to the procedure people often worry about most, joint replacement.
Yeah, the endpoint procedure we all dread, as the chapter puts it. And look, it's major surgery. Recovery is tough. There can be complications.
And the satisfaction rates aren't perfect, especially for knees.
Right. The book mentions dissatisfaction approaching 20% for total knee replacements. That's significant.
There's progress being made there too, isn't there?
Huge progress. The chapter highlights things like custom-made knee replacements.
Custom.
They use a 3D CT scan of your knee to design an implant that fits your specific anatomy perfectly.
Wow.
And get this, they even use 3D printed surgical guides, also based on your scan, to make the bone cuts incredibly precise during surgery. Better fit, better alignment, hopefully better outcomes.
That's pretty amazing tech. So this chapter really covers the whole spectrum, from simple lifestyle tweaks to, well, custom robot-assisted surgery.
It really does.
If you had to boil down Dr. Workman's main message from this whole chapter, what would it be?
I think it's really about agency. Yes, genetics play a role, past injuries matter, but you have a lot of control over how your joints fare over time. It's not just inevitable decline.
It's about active management.
Exactly. Managing the load, managing the movement, listening to the signals. You can really influence your joint health through smart choices.
So recapping those key actions, keep the weight managed.
Yeah. Choose lower impact activities thoughtfully, but keep moving consistently.
Incorporate strength training for support, not just bulk.
Right. Pay attention to good nutrition. Allow for that longer recovery time.
And don't hesitate to explore the options if pain persists, whether it's supplements, meds, injections, or even seeing if those advanced surgical options are right for you.
Absolutely. Know that effective strategies exist at every level.
Honestly, this chapter in The 21st Century Man is just incredibly practical and comprehensive. It gives you layers of options. If joint health is on your mind, seriously, get the book and read this chapter carefully.
I agree. The level of detail is fantastic, from specific exercise ideas right through to the latest medical tech. Really valuable stuff.
And thinking about that tech, the custom implants, the mapping, it makes you wonder, doesn't it? Here's a thought to leave you with. What might the next step be? Could we see advancements that focus even more on prevention, or maybe even reversing early damage before replacement is even on the table?
It's definitely heading that way. Regenerative medicine is a huge area of research. Fascinating possibilities.
Indeed. Well, thank you for joining us for this deep dive into Chapter 38, all about joint health.
Yeah, thanks for listening, and definitely join us next time. We'll be tackling Chapter 39. Remember to stretch.